The primary presenting sign of Gaucher disease that leads to diagnosis is frequently nose bleeding during infancy, for instance, and low platelet counts during pregnancy can be a first sign. Women who develop more evident sign of Gaucher disease, like huge splenomegaly and bone pain, frequently in their story, they remember that during pregnancy and during delivery, they were said that they had thrombopenia. So it's important to tell, for instance, the obstetrician that it can be the first sign of Gaucher disease, thrombopenia during pregnancy. The other sign is splenomegaly. But if the splenomegaly is moderate, mild, the physician can miss it. And if the physician doesn't do the palpation of the abdomen, the sign will be not done, the diagnosis will not be done by the physician. So frequently, patients are non-diagnosed because of moderate thrombopenia and because of a very mild splenomegaly. And during years and years, and suddenly after there is a bone event, for instance, and when you go to the story of the patient and she shows you her previous blood sample, you can see that from years and years she had a mild thrombopenia, and during the palpation you feel the big spleen. Some children, they have bone pain, have growth pain. We don't know if growth pain exists. And growth pain, we must have an explanation. If a child has pain in the knees, for instance, during the night, if it's very painful, it can be the first sign of Gaucher disease. And frequently, a teenager that I met with the diagnosis, they remember, and the family remember, of bone pain, chronic bone pain. And sometimes it's not very acute bone pain, it's chronic bone pain. And unfortunately, the diagnosis is frequently not made before in front of this bone pain. And the other thing is children frequently go to the emergency department because of hip pain. And imagine that the first department who received the child is an orthopedic department. So he will make a diagnosis, for instance, of osteomyelitis, because it's frequent. It can be frequent osteomyelitis in children. The physician will give antibiotics and will do a punction, and after 10 days, the pain will decrease. And the bone crisis in children due to Gaucher disease is frequently misdiagnosed as osteomyelitis, for instance, or bone pain of other origins. So that's very important to make the diagnosis of bone pain in children. And because the child arrived in an orthopedic department, sometimes the palpation of the spleen is not made. Sometimes if the platelets are quite normal, but just under the below normal, so nobody sees these abnormalities and the diagnosis is not made. I have an experience of a child, but he was a teenager at the time. He went 3 times in the emergency department in one hospital because of bone pain. 3 times, at the age of 6, at the age of 8, and at the age of 12. And the diagnosis was not made. And a resident had read something on Gaucher disease. I said, probably it can be Gaucher disease. So bone pain in the child, a growth pain, mild splenomegaly, and mild thrombopenia. And palpation of the spleen is important. Every physician must, when he see a patient, do the palpation of the spleen. It's very important to make the diagnosis early in Gaucher disease. Why? Because it's a very heterogeneous disease, and sometimes it's difficult because it's a rare disease, and a rare disease during your medicine studies, sometimes you have heard only once of the name of this disease. So it's important to be aware of this rare disease, to make the diagnosis, because after years of evolution of the disease, the lesions are completely reversible for some kind of lesions. For instance, bone marrow infiltration may lead to bone infarct, and after there is scars in the bone and chronic bone pain. The second thing is that not bone infarct, but spleen infarct can lead to fibrosis. And fibrosis scars in the spleen are also irreversible lesions. For the patient and the family, we organize a session of information with the Association of Patients. And it's very important because they want to know about the disease, they want to know how to monitor, how to be followed. And it's part of our mission because when you are in a referral center for rare disease and for Gaucher disease, it's important to work with the other physician in a multidisciplinary team, very important, not alone. Alone you can do nothing. In rare disease, the first mission is the training of new medical students, because we really need new experts in the field in rare disease. So training of new medical students, of residents, and to encourage them to be specialized in rare disease, in Gaucher disease. Then we have an epidemiologic mission, so it's important to organize, to set up a registry for rare disease, to know the natural history of the disease, to know exactly what is the correlation between the phenotype and the genotype. So because this disease is an autosomal recessive disease, it's important that inside the same family, sisters and brothers must be tested, because it's important to know if they have the disease. But sometimes it's difficult to tell the patient that his sister, his brother must be tested, because there is not a correlation inside the same family concerning the severity of the disease. So one may have a very severe disease, and inside the same family an asymptomatic disease. And it's sometimes difficult, but it's very important to explain to the patient that inside the same family, sisters and brothers must have a diagnosis of Gaucher disease. And it's very easy, it's a blood sample, or there are other methods. Even if the patient is asymptomatic, the monitoring or clinical evaluation is important in the aim to prevent an event, a clinical event or a burn event.